Welcome and thank you for joining us for today's The Rebound Kansas City Town Hall. This is our community continues to try to recover from the ongoing coronavirus. I'm 41 Action News anchor Caitlin Canute. The holidays are just around the corner, in 2 days to be exact, but this year is certainly unlike any other we've experienced. While some people are struggling to make ends meet, others are experiencing grief and loneliness, all while health officials are cautioning us all to stay home. Today, we're bringing professionals to the virtual table to discuss where the local economy stands, the vaccine, guidelines for holiday gatherings, travel, and appropriate coping mechanisms for those who need them. We're joined now by Dr. Dana Hawkinson from the University of Kansas Health System, Dr. Jessica Benito from the Center for Healing and Recovery, and Joab Ortiz, the chair of the KCK Chamber Board of Directors. Thank you all so much for joining us today. For those of you watching online, you can feel free to submit questions via our Facebook page, and we will pass that along to our guests. So let's begin now with what's on everyone's minds: how to safely celebrate the Thanksgiving holiday as COVID cases continue to rise in nearly every state. So Dr. Hawkinson, let's start with you. We know the safest thing you can do right now is simply to stay home, but if people don't heed that advice, what steps can they take to at least minimize the risk?
Yeah, you're absolutely right. The CDC has strongly urged everybody to stay home. And we've talked about this on our update with Dr. Stites and myself. You know, hopefully preparing before this time, 10 days, 14 days in advance, to stay quarantined or isolated from anybody else until you have to travel. So then once you do travel, certainly car travel is much safer than air or train or bus or anything like that. And when you're in households or you are combining households, understand that you still need to take those other measures. Distance is better. 6 feet is better than 3 feet. 8 or 10 feet is better than 6 feet. And certainly if you can eat outside, if the weather is good, do things outside. Masking is extremely important. Doing all those things can reduce the risk of the spread of the disease. It's not going to be 100%, but it will help mitigate some of that risk of giving it to friends, family, to loved ones who are in those vulnerable populations for critical illness.
Thank you so much, Dr. Hawkinson. We've heard you say, we've heard the CDC say, if you really want a foolproof plan, just stay home, celebrate virtually this year. Thank you. Now, Dr. Benito, for you, what is the best way for us to support perhaps our relatives who are older or who are at high risk during this time, who might really be feeling lonely or isolated?
Absolutely. This is such a difficult time for everyone, but it certainly puts our older population at higher risk. In general, we know that loneliness is something that they can struggle with. So this is definitely an important time to keep a check on them. So one of the things that I like to encourage people is to create a schedule for themselves. So making things as normal as possible during this time is really important. So if you have an older relative or a loved one, checking in on them and helping them to normalize this time by trying to do things every day that they normally do, keeping up with their normal routine much as possible. And then as a relative of an older person, checking in on them regularly so that they continuously hear from us, know that we care about them, that they're on our mind. And of course, right now everybody's doing virtual because that's the safest way to keep our relatives in their homes and ourselves still being connected to them. So a lot of the times I find that older adults maybe sometimes struggle with some questions about how to handle technology because it may not be the norm for them prior to this whole pandemic. So check in on them, see if they have any questions or fears of using their smartphones or tablets. If they don't, maybe that's something to keep in mind for the holidays. Maybe a gift to them of a tablet would change their world where they could be able to connect with you, connect with grandchildren, connect with loved ones, spend time with them virtually while still doing that safely, and also being able to keep up with their health care. So that's really important, is that older adults, as in their goal to continue keeping safe, also maintain a check on their health. So making sure that they still keep up with virtual appointments as much as possible. So staying connected in the ways that are possible right now is super important for them.
Yeah, absolutely. Great advice. Think outside the box. So speaking about wanting to check on a loved one who maybe is isolated at home, this is a perfect time to bring in a question we received from one of our viewers. Shirley asks us if you prepare a plate for either a hospital patient or for someone perhaps who is at home isolated. Are there any safety measures I need to take? So this one can certainly pertain to eating on Thanksgiving or really any time. So Dr. Hawkinson, let's throw that one to you.
Yeah, I think if you're preparing a plate for somebody, obviously you're probably going to be wrapping it in a container or putting it in a container. The biggest thing you can do if you're not planning to eat with them, you can leave it on the step. Really, the risk of transferring or giving the infection to somebody from these inanimate objects, such as the plate or the container, is very low. But regardless, if you're receiving that meal, get it prepared so that you're about to eat it. The last thing you want to do right before you eat is wash your hands, do good hand hygiene, and then eat. But I think really the risk of infection from preparing a plate for somebody and dropping it off is really minimal at that point.
Well, that's some good news there. Hopefully the days of having to wipe down all of our groceries are over, but washing hands is still very, very important.
Yeah.
Mr. Ortiz, speaking of picking up holiday plates, this pandemic has really taken a toll on our restaurants and our small businesses. So how can we best support them during this time?
Well, I think right now what we talk about at the Chamber is the initiative to buy local, and the idea that you've got gifts that you need to buy, presents you need to give to family members, friends, teachers, for all those people that are working hard in our community. What a better way to do that than to look at gift certificates and other merchandise from local businesses. We also recommend calling a business in advance to make sure that when they're going to be open and understanding what their practice are so that you're not going in unprepared, following guidelines that have been set out.
Okay, so do your homework online, see if somebody is open or what requirements they have, and there's still lots of ways we can support our local businesses, whether it's getting carry-out food or it's ordering from them online. Now, the CDC is advising people not to travel for Thanksgiving, but realistically, we do know many people will. In fact, take a look. This is a photo from KCI on Saturday showing crowds of people preparing to leave the city, and the TSA is already recording its busiest week since March. Here's what some travelers told us yesterday at KCI.
I think it just adds just a little bit more stress. I don't really travel too often, like on a plane anyways. This is my first time, so just a little bit stressed.
I just wash my hand after I touch anything every time.
As long as I'm careful, I will continue to travel. I have continued to travel, and life goes on. I have to get out and enjoy.
So, Dr. Hawkinson, as you listen to those statements, for those people who are still weighing their options for Thanksgiving or even looking ahead to Christmas, what factors should they consider before deciding whether or not to travel?
Yeah, I think the first thing is to understand that the virus is out there, and community spread is so prevalent right now. And that isn't to mean to cause fear, but more knowledge and just understanding of the larger concepts. And number one, the virus is out there. Number two, you can do those large conceptual things to reduce your risk of spread or getting the disease, even if you're traveling. And that's masking, wearing a face shield or goggles in addition to the mask. If you're in an airport, really try to continue to maintain distance away from people, doing those sort of things. I heard one gentleman talk about hand hygiene as well. So doing all of those things, understanding those large concepts. But it all starts with just understanding and knowing that the virus is out there so that you have the knowledge to continue to do these things. And it will become second nature, wearing the mask, trying to maintain your distance around from others who are not in your household. Doing those things are going to be the best way to reduce the risk of spread of infection to yourself and to your family.
Dr. Hawkinson, are you more likely to expose yourself on an airplane or when you actually get to your destination and perhaps you're a little more lax about wearing that mask? Which is the greater threat, the gathering itself or the travel to get there?
Mm-hmm. Yeah, I think that possibly the gathering itself, we have seen and heard of countless anecdotes of people who have gotten ill and really either not known where they did or just met up with a few friends who they thought were in their bubble. Unfortunately, you don't know necessarily who is in those people's bubble. So when you let people in from who are not normally in your household, you don't have a full understanding of where they have been, who are they interacting with. And we understand that so much of the spread now is really related to people who are either pre-symptomatic, meaning they don't have symptoms yet, or asymptomatic, who have no symptoms and will not have any symptoms. And so because of that, that is why this virus is so dangerous and so difficult to contact trace and also understand where exactly you got it now that it is so prevalent in the community.
Yeah, so important to wrap our heads around that. Thank you, Doctor. As winter approaches, we know case numbers are spiking already across the United States as well as right here at home. So take a look. Here are the latest numbers. In Missouri, local and state health departments added 3,790 new COVID-19 cases yesterday. That brought the total cases to more than 289,000. The death toll now stands at more than 3,700 after 6 additional people died. Again, those are the numbers from Missouri. In Kansas, local and state health departments added 7,002 new COVID-19 cases yesterday. That is a new single-day high in new cases. The number of Kansans who have tested positive for COVID-19 now stands at more than 143,000 people. We know Kansas and Missouri have different guidelines as well as some cities and counties in our area. So in Kansas City, Jackson, Wyandotte, Clay, and Platte counties, gatherings are now limited to 10 people. In Johnson County, the limit is 50 people. And if you go to a restaurant in many of these locations, you're required to wear a mask at all times except when you're eating or drinking. In Kansas City, Jackson, and Wyandotte counties, restaurants and bars have to close at 10 p.m. In Kansas City, tables cannot be larger than 10 people. In Jackson, Wyandotte, and Johnson counties, the number is 8. Restaurants in Johnson County can stay open until midnight. So, Mr. Ortiz, another business question for you. How are businesses in Wyandotte County responding to these changes?
The struggle is with the inconsistency from one community to the next. Our businesses would like to stay open and be open as safely as possible for the duration that the one down the street is. But when the one down the street is open until midnight and ours is open until 10, there becomes a challenge. That's where the struggle is from a financial perspective, because people will go across the state or across the county line to go to business there, as opposed to coming to ours because it'll close early. Some consistency across the board is important, and we feel like that's something that we're advocating for across the board, not for less restriction or more restriction, but consistent restriction for all businesses. That's the way that we're going to be able to continue to thrive or survive this pandemic.
Yeah, Mr. Ortiz, I understand you're saying, the different guidelines, different states, even different counties right now, that lack of uniformity is kind of impacting local businesses. What would you like to see surrounding areas do to make sure that all businesses are kind of on a level playing field?
Well, initially when this started, all the local governments got together and it appeared there was going to be some consistency, but then it fractured, unfortunately, and so now we're seeing different rules for different places. I can tell you that in Wyandotte County, the Chamber of Commerce is working with the Visit Kansas City and the Wyandotte Economic Development, as well as with the Unified Government, on a Keep Waco Well initiative. They're just to promote safety through business, providing PPE, providing opportunities for businesses to stay open safely. So we are coming together as a community and working together to stay safe as best we can with the guidelines and restrictions that we have. That's how we're able to do it in Wyandotte County.
Well, we have another viewer question now. Mike wants to know, why is the restaurant industry being blamed for the increase in cases? So since this is a health-related question, Dr. Hawkinson, we're going to send this back to you. So first, I don't know that the restaurant industry necessarily is being blamed, but I think there is that perception because we're seeing some changes, some restrictions that are affecting the restaurant industry. So do you want to kind of shed some light on that?
Yeah, absolutely. You know, it is a shame about that. We've unfortunately seen so many businesses, workers, employees, businesses shut, workers, employees, not having a job, not being able to put food on their table and earn a living. It is very difficult, but we do understand from the earliest parts of the pandemic that people are getting together in those businesses, restaurants, bars, things of that nature. Now, we have good proof and publications that show that even when people wear masks, they think they're wearing masks, that they go into these places, take off their mask when they're sitting at the table or whatnot, and still get the infection, even though they think they've been very good masking. But I think now as we're seeing more and more of the community spread, and we know that the holidays are coming, we know that there are get-togethers such as watching football or Halloween parties or things of that nature. And it's not outdoors like in the demonstrations or the Ozarks where we saw all those outdoor parties, but now we are going inside to private homes. So I think that the spread right now is really occurring mostly due to the fact that people don't understand they have the disease and they're spreading it, but also it's that private home or private party get together. Not only the restaurant industry, but we've talked about other things such as funerals or parties or things of that nature where people are still getting together. It is unfortunate the restaurant business and industry has taken a lot of that heat, but we do understand that it's with the other get-togethers as well that I mentioned. So it is not only that, but it is whenever people are gathering, and whether that's in the private homes or for celebrations or for grief services like a funeral, it is that place where people are getting and spreading without even knowing it. We do know that there have been countless now records in the news about things like weddings, when it should be a joyful time, but they can be linked back to many infections can be linked back to a certain event, such as a wedding or a reception of that nature.
Yeah, really, anytime we have people in close quarters, close contact, there's that
Yep.
risk for super spreader events. Now, we recently ran a story about Don Chilitos, a Mexican restaurant in Mission. The owner there says he will not comply with the mask mandate in Johnson County. So take a listen now to what he told one of our reporters about wearing masks as a way to keep people safe.
I don't believe it. I don't think that there is any science that proves that. It's supposed to be a free country, and we can make our own decisions, what we do in our lives, and our businesses.
And I know that must be frustrating for our health experts here to hear, since we know that research does show that masks do in fact work. Mr. Ortiz, are there businesses refusing to comply in Wyandotte County? And what message do you have for business owners who perhaps refuse to follow the COVID safety guidelines in their establishments?
You said that was frustrating for the health folks on the call, and me. I would say that that's also frustrating for the business community as well. The lack of consistency that we have from business to business and participating in what we know is necessary for the community. So the Chamber of Commerce is promoting, encouraging everyone to follow the guidelines that are pushed forward. We understand that some businesses don't want to comply for whatever reason. We're strongly encouraging those folks to comply because we can't get through this if we don't. And so Chilitos or any other restaurant business, we're gonna ask them and encourage them and continue to pressure them to comply, because that's the only way that we're all going to get through this.
Yeah, right now no one likes wearing a mask, but we do understand health leaders say that wearing masks can help us to keep those businesses open if we can comply with those guidelines. On the vaccine front, the first Americans could receive the coronavirus vaccine possibly in just 3 weeks, but many people have been questioning its safety. So before we dive deeper into that topic, here's I-Team reporter Jessica McMaster.
The primary goal, can we protect people from getting really sick? That in the short term, that's definitely what it looks like.
Dr. Spiro Callums is the principal investigator of the Moderna vaccine trial at Vanderbilt University Medical Center. One of 2 vaccines that shows promise in the fight against COVID-19. But many people are expressing skepticism with the quick timeline of its release.
Were steps skipped?
All the safety protocols were followed. I mean, I don't know anything that I could have done better to make sure that the vaccine is safe.
Dr. Callum says the process moved quickly because the money and technology were there, and the process for hiring a team of researchers started immediately as opposed to the traditional 12 to 18 months. More than 30,000 participants joined the trial, each one given 2 shots over a 4-week period.
After that, we wait. We accumulate symptoms. They have diaries, people enter information.
Infections are reported to an independent monitoring board. 95 people got symptoms of the virus, but most of those came from the placebo. Side effects from the actual vaccine include fatigue, headaches, and feeling unwell.
You're making an immune response, and that's actually a good thing.
Connie Satzler with Immunize Kansas Coalition helps connect the public with credible resources on vaccines. Separating fact from fiction can be a challenge, she says, in a world where fear drives misinformation.
I would encourage people to not look for information to verify those concerns, but to look with an open mind at scientifically credible information from all sides. Look for that scientific consensus.
One site Satzler suggests is historyofvaccines.org, established by a group of physicians. The site provides information on side effects and also debunks myths. No deaths have been reported during the trial. Moderna is in its 3rd month, which leads researchers to believe people will remain immune after getting the COVID vaccine for at least that amount of time. In Kansas City, I'm Jessica McMaster, 41 Action News.
So speaking of that, we're getting a lot of questions about the vaccine. Ron, for example, one of our viewers asks, quote, is the vaccine something you would do once, 2 shots 3 weeks apart, or is it likely to be an annual vaccine like the flu shot? So Dr. Hawkinson, I think they're asking, is this like a polio vaccine that you take it once, you're good for the rest of your life, or is this going to be like the flu shot every year? What do you anticipate?
Yeah, I think the biggest thing that we're anticipating right now with this first generation of vaccines, that it will probably be a yearly vaccination process, just as influenza is. Right now, again, most of them are 2 doses, and one at the first time, and then the next one 3 to 4 weeks later. But then we are anticipating that probably it's going to be a yearly vaccination schedule. But who knows, as we get further down and maybe 2 or 3 generations of vaccines down the line, it may be just a one-time thing. But right now we are anticipating probably a yearly vaccination schedule for this.
Okay, and we've been so focused on the physical effects of this pandemic, but obviously the emotional, mental toll, I mean, that's something we really have to address as well. This time of year can be hard on a lot of people in a normal year, but then you throw a pandemic into things. Dr. Benito, what message do you have for those who maybe have lost a loved one and will be celebrating the holidays for the first time without them? Kind of give us some ideas on how we could help people handle grief this year.
Absolutely. So the first and most important thing to remind ourselves is that we deserve to feel whatever we're feeling. And sometimes we get caught up in wanting to only feel positive things, that we create a stigma around all of the feelings that come with grief. And grief looks different for everybody. So realizing that just because you're processing the loss of a loved one in a way that looks different from another relative or a sister or brother that has maybe lost the same parent doesn't mean that there's a right or wrong way to feel. Grief has a way of functioning very differently in everybody that is non-linear. And so giving ourselves that space and that time. Grief takes time, and it can also appear in very non-traditional ways. So when we think of grief, a lot of times people focus on a sense of sadness, crying, everybody. So again, things to keep in mind is recognizing the signs, and sometimes that looks really non-traditional, like just having trouble focusing, changes in our sleep behavior. Maybe we're sleeping more or less than usual. Maybe additional non-normal feelings of anger or irritability. Actually, grief can also take a toll on our physical well-being. So notice if you're experiencing fatigue, low energy, if we're having headaches that are out of the usual for us, upset stomach. So a lot of different ways that we can be feeling that grief and giving ourselves permission to feel it. And of course, check in with your loved ones. If this is a shared loss, check in with people, because sometimes people don't know how to express their grief. And the most important thing is being able to validate those experiences. And as the holidays come up, maybe you're just feeling the grief a little bit more, might have included these loved ones, especially if they're older adults, parents. And so finding ways to honor those loved ones, creating new traditions with the family members that are there to be able to celebrate the life of the ones that you loved, and being able to experience the holidays and still celebrate the joy of the connection between the ones that are there and the feelings of loss over the ones that have gone and passed on. And lastly is just practicing self-care. Right, remembering that this is a tough time for everyone, especially for those that have lost somebody. And so taking time to look after yourself is not only appropriate, but absolutely healthy and necessary.
Yeah, I love that you said it's okay to feel these feelings and respect that, but take care of yourself. Be good to yourself this season. Of course, we understand that some families really want to be together for comfort after experiencing a loss, and others just want to be together, period. And that's leading to busy testing sites as people line up to try to make sure that they're negative before seeing relatives. But we want to caution you, don't put too much faith in that test result. Dr. Hawkinson, other health experts have recommended that people get PCR tests instead of rapid testing. So first, what's the difference between those two? And with Thanksgiving coming up, when is the best time to get that COVID test to ensure that it's accurate?
Yeah, so the gold standard of testing for SARS-CoV-2, the virus, that causes COVID-19 is the PCR test. This stands for polymerase chain reaction. It's a molecular test. It's actually looking for pieces of the genomic material of the virus itself. And that tends to be more accurate, especially if you can get a good sample. The gold standard of sample taking is the nasopharyngeal or NP swab. With this, because you can start to amplify even small amounts of the virus or the viral genome to get a good, accurate answer. So that is the gold standard. That is the best test to use. It's the PCR test. The second one that is more popular is growing in popularity is the antigen test, but this is not as accurate. This can also depend on really how the sample was obtained. Was it just from the front of the nose, or was it the NP swab that goes further back into the sinuses? Some people would say and have the theory that, well, if you're negative on the antigen test, that just means you don't have enough virus to be infectious. But we don't really know that for sure. So I would encourage everybody, if they're getting tested, although we know that there are problems with the turnaround on the test result times, to get the PCR test. Even if you do get an antigen test and it's positive, then you are most likely positive and it's not a false positive test. But if it's negative, there is a chance you could still be positive, and so that test needs to be followed up with the gold standard PCR test to see if you really are negative for the virus infection.
Yeah, and Doctor, we're looking at, we just had a video popped up. We came up with kind of a hypothetical situation where you could be exposed and not know it. You could get tested before Thanksgiving, test negative, but then really be positive and infectious 2 days later. So if you're going to get tested, how long do you need to quarantine before that test to make sure that if you did have the virus in your system, it would show up on the test?
Yeah, absolutely. The CDC has really recommended that everybody who's an exposure to get tested. But unfortunately, there's not a lot of guidance on when. We have kind of settled on, say, 6 to 9 days from your exposure, your last known exposure here in our health system. And that's mainly based off the information that most of the people that will have symptoms within 5 to 7 days after exposure. I certainly would not get tested any shorter than 48 hours after the exposure, but really in that 1 week period, so 6 to 9 days. Also, unfortunately, if you are an exposure and you are in quarantine, you cannot test out of that quarantine. So even if you do get that PCR test and it is negative, you have to continue to serve out your 14 days of quarantine time.
Yeah, that's so important. Thanks for explaining that, by the way. Don't go anywhere because we have another viewer question for you. And this is a great question. Julie asks, is there still a risk if you are inside 10 feet apart, but with no mask on? What is more important, the mask or the distance? Dr. Hawkinson?
You know, they're all taken together. Again, we've heard that owner of that restaurant say he doesn't believe in masks because there's no evidence. There's indisputable evidence that masking works, but a lot of these studies are also done in conjunction with the other measures, and that's hand hygiene. That is also with distancing. So they are both very important. Distancing, masking, and hand hygiene, those are the biggest things that we can do to prevent it. It's not just one or the other. It really has to be all of them. So it's difficult to say, is it mask or distance? Certainly, we know that with the reports of the hairdressers that were wearing masks, and of course we know hairdressers have to be so close to their clients. We know that of those people that they were able to interview, none of them had gotten the disease. So in that case, certainly masking is important. But both parties need to be masked because masking acts as a barrier if you are infected and you know it, or if you are infected and you don't know it. But it will also serve to act as some protection for you, the mask wearer, as well. So they are both important, the distancing and masking. They're taken in conjunction with each other. But, probably, I guess if you had to pin me down on one, I would certainly say masking is probably more important. But I would advise everybody to continue the distancing and the hand hygiene as well.
Okay, all right, they go hand in hand, absolutely. Now, facing decisions such as whether or not you'll celebrate with family and worrying about your safety and that of your loved ones can definitely cause anxiety. So, Dr. Benito, what are some tips when it comes to managing anxiety specifically?
Absolutely. So, one of the first things that we want to do is realize that we don't have to do it all. We might have a lot of things to juggle and a lot of demands on our time, on our energy, and being able to prioritize and really decide what is the most important thing for me, for my family right now, helps us to be able to diminish that feeling of being overwhelmed by way too many things. And so part of being able to handle that anxiety and that feeling of being overwhelmed by all of these demands societally and within our families and concerns about safety is also about being able to set healthy boundaries. So this is a really important time for us to realize that not only are physical boundaries, like we've been talking about, important for our safety, but also emotional boundaries are important. Being able to tell ourselves that it's okay to not do it all. Being able to tell others that it's okay that I can't do it all, that I need time, that I can say no to all of the different demands. And especially with safety, feeling safe enough to be able to tell loved ones, hey, I don't really feel safe doing that. I would rather stay home, and not putting on the added pressure that sometimes comes with the expectations of holidays. And one of the most important things to handle anxiety in general is being able to make a distinction, especially right now, is being able to make a distinction between what is in our control and what is not. And so many of the things that we are all facing right now are outside of our control in terms of, how big this is, but so many of them are. And so just like we've been having this conversation about what's in my control, whether I wear a mask, the distance that I keep, it's also about realizing what isn't. And so being able to handle worries in a healthy way is very important. And sometimes we just need to learn to set boundaries with our own thoughts and our own worries and realize, hey, is this thought actually helping me? Is this actually helping me to problem solve whatever I have going on? And if it's not, being able to learn to let that go. So finally, keeping some mindfulness as a practice that we learn to do every day, which is just to pause. And let's not underestimate the power of taking deep breaths during the day, just creating moments to pause and teaching that to our kids, modeling it for family members, that it's okay to pause and just stop and give ourselves time to process, and prioritizing what those things are that we really need to focus on.
Oh, great advice. I'm so glad you mentioned the kids, because they're really watching us more than ever. They're home with us much more than ever. And so, yeah, they're watching how we handle the stress of this pandemic. Speaking of kids, the older kids, many colleges and universities have decided to do virtual classes after the holiday, which means many college students will be coming back home. So, Dr. Hawkinson, how do you anticipate that impacting the rate of COVID cases locally, if at all?
I think it's variable. We understand that the past few weeks or a couple months, we understand that the younger population, so 40 and under, 30 and under, have been major drivers of the spread of the disease and have been a major component or a proportion of the new infections that we see. It's difficult for most of us not to be with friends. I think it's even more difficult for the younger population not to be with friends. Although they are a lot better at using devices and talking through that and things of that nature, there still is that need to be with each other, whether it's small get-togethers or parties or things of that nature. It certainly could have a continued effect on the spread of the infection overall, though.
Well, with so many schools going back to virtual learning after the holidays, as Dr. Hawkinson said, this can really have an impact on our younger students, our teenagers especially. Take a listen to what one high schooler told us.
That lack of social interaction is very it takes the biggest toll on my mental health, because as stressful as school is, I've always used it as a getaway from the stress that I'm brought in within my family or with other aspects of my life.
Yeah, as Dr. Hawkinson said, they're much better with technology, so they can communicate that way, but it's not the same as the real deal. So Dr. Benito, what are some appropriate coping mechanisms for those teenagers, so our college students, our high school students, even junior high, who might really feel alone or stressed right now? And I think Dr. Benito has frozen up. All right, so we will try to come back to Dr. Benito with that
Absolutely.
question.
And
oh, wait, there she is.
That is a reality, and they are a mission that.
If you can hear us, go ahead, Dr. Benito. You just froze up temporarily. Okay, we are having some technical difficulties, so let's come back to her in a moment. Let's go now to this viewer question. Julie asks, should I be concerned setting my kids back to daycare after the holiday? She says, I'd hate for them to pick up COVID at daycare after we were so careful canceling Thanksgiving plans. And what a great point. You can do everything right, but there's this chain reaction, Dr. Hawkinson. So what do you suggest to parents in that situation?
It's difficult. Childcare is essentially needed, and this has been an issue since the beginning of the pandemic, when really childcare facilities were not shut down because it is important. Parents need a place to take their children for care during the day when they are off at work. It's a very tough decision to understand. I think you can do the best that you can do by understanding the risks of taking your child to that place. How many other people are in that facility? What are their protocols there? Talk to either the administration or the child care professionals in that facility and just try to understand, because it is very difficult. Most people who have young children need someplace to take their children for care during the day while they are at work. So, we know children can get the disease. They probably won't be as sick, but we know they can spread it as well. And I think just doing your due diligence and understanding the risk, but also talking with that facility to really make your decision, make an informed decision about going back to that facility and getting your child that child care during the day when you are gone.
Good advice. Well, Thanksgiving will look different for many of us, so will Black Friday, but stores have already prepared for the reduced crowd. So I want to talk to each of you about this year's holiday shopping experience. First, though, let's take a listen to Consumer I-Team reporter Kat Reed, who shares some of the changes.
The massive crowds of Black Friday won't be a sound of the season this year.
I always thought that was kind of insane anyways. People are probably going to more online shop than want to go out on Black Friday.
That's true, according to experts at Retail Me Not, a site that aggregates coupons and deals.
88% of people that we surveyed said they're not going to be shopping those crazy doorbuster deals on Thanksgiving, which leads me to believe that on Black Friday, people will be shopping from the comfort of their own couch.
So retailers are changing the way they do Black Friday.
Everybody seems to be offering Black Friday deals very early.
Black Friday used to mean long lines and deals gone in a flash. That was Black Friday then. This is Black Friday now.
Target is turning it into a month-long event with different deals each week. Walmart and Home Depot are also extending their sales, so you can start shopping now. Sarah Skirball of Retail Me Not shared her go-to resource called BlackFriday.com, where you can see all the deals of the season.
So if I know I need a TV or an Instapot, I look at all of those leaked ads, as we like to say, on BlackFriday.com, and I see who's going to offer me the better deal. So a couple of minutes of research can really save you a couple of extra bucks in the long run.
And if you're planning to do more shopping online, consider installing a browser extension.
One I love is called Deal Finder, and what it does is basically applies all of those coupon codes and cashback offers across the internet right automatically at checkouts.
Most importantly, start checking off that list ASAP. Online sales increased during the pandemic, so carriers are already under pressure.
If you want to avoid shipping delays, if you want to avoid any inventory issues, I recommend starting now.
That way, all the presents arrive in time for the holiday. I'm Consumer I-Team reporter Kat Reed, 41 Action News.
And here locally, Black Friday is a big day for stores such as Nebraska Furniture Mart, Walmart, and Best Buy. You're looking at some file video from years past. We've seen crowds of people rushing into these places. So Dr. Hawkinson, obviously we hope to not see that, big crowds packed together tightly. But for those shoppers who might be doing in-person shopping this year, what can they do differently to stay safe?
I think it's a matter of, obviously if you work, it's difficult, but trying to find those times when the stores are less busy. I don't know exactly what those are. It probably depending on what store it is, but trying to understand maybe when the mall is less busy or certain stores are less busy, probably the weekends are going to have more people than not. See if you can get a deal online. I would start online first, but then from there determine, where will be the least amount of people at whatever certain time. Is it right when they open? Is it later at night when they're about to close? Or is it the middle of the day when a lot of people may be at work? So I think trying to figure out those times is probably going to be your best move going forward.
Yeah, shop strategically, wear your mask and social distance. Mr. Ortiz, Small Business Saturday coming up this weekend. How is the Chamber supporting local businesses that perhaps are struggling to keep the doors open right now?
We've been using social media, as you said earlier. Social media.
All right, well, Mr. Ortiz, we're having a hard time with your audio, so we might take a break here, see if we can fix that audio. The joys of technology, right? We'll try to come back to you in a moment. But again, very important to make sure that that we are supporting our small businesses.
Yeah.
Dr. Hawkinson, what would you recommend to your family? Can you shop? Do you think it is possible? I mean, are we doing contact tracing where we're seeing outbreaks in stores where people go in and everyone is wearing their mask?
Yeah, I think just as you said, maintain your distance in those stores. You're not going to be really interacting with anybody too long in those stores. 10 or 15 minutes, you probably won't be interacting that long. And just as you said, wear their masks. And I think most of the places, the retail places around the city and around the region have really gotten good about mandating mask use within those stores. I think you certainly can be safe. If you're waiting in a line, really try, like you did when you voted, really try to maintain that 6 or 8 feet of space in front and behind of you so that you can maintain your distance. You have the mask on. You know that for the most part, you're not going to have really close interactions with one person. So I think in that way, you can feel confident you're reducing the risk. But, you know, in addition to distance and masking, make sure you're using hand hygiene and do all of those things. And again, try to find when it may be less busy. I think doing that is going to be the best thing that you can do to reduce your risk of getting the infection or spreading it to others as well.
Yeah, and since you mentioned that, it's important to make sure that we're not spreading it to those folks who have to work. Those are their jobs, and so let's wear our masks to keep those employees safe too. And Mr. Ortiz, I think we have you back online here now, so let's try that again. If you could share with us, how is the Chamber supporting local businesses that are struggling right now?
Sure. Yeah, so actually how we're doing this through social media and through online platforms. We've done a lot of webinars on how to promote their businesses. We've had over 3,000 attendees at various webinars that we've held over the course of the pandemic, just to encourage and support businesses. We'll continue to do that through all the social media platforms the Chamber participates in, just to promote the local businesses. You know, large and small. I know Nebraska Furniture Mart, you mentioned earlier, they're a great example. We've been working with them. They've given us 3,000 masks to give out to local businesses to help to keep them open. They're also promoting safe measures in their stores. They've reduced the number of people that can be in their stores and taken a lot of precautions there. I think across the board, we're all doing what we can.
Yeah, and hats off to all of the businesses for adapting in this constantly changing atmosphere. They've really been utilizing social media to kind of reach out to us, the consumers. One of the focuses for Rebound KC is helping people get back to work and find the work that's available. And so usually around this time of year, we see a huge increase in seasonal jobs. But Mr. Ortiz, are there differences you're seeing this year in terms of the types of seasonal jobs and the number of opportunities being offered? Are there jobs out there right now?
There are jobs out there. They're just not as many. Obviously, the market is softer, and so we recognize that there are opportunities, whether it's at
And wouldn't you know it, technology froze up on us again. Mr. Ortiz will try to reconnect with you in a second. But as you were hearing there are jobs that are available, and we will continue to try to post those on our website. Well, here, let's move to a question. I've got a question for you, Dr. Hawkinson. Another viewer asked us, quote, is there any reason to not celebrate with family members if everyone has tested positive for the virus within the last 6 to 8 weeks? This is what's so interesting. We keep talking about how long do you have those antibodies? So if everyone's been sick, can we all get together?
You know, I think the best advice we've given to people is that even if you have been sick, you really have to take those precautions, those public health measures. I guess if everybody's been sick, but you know, it's still very dangerous because we don't know how long immunity lasts. We know that there is a heterogeneity in all of the research articles about how long antibodies last. Some say they last for months, some say they last a few weeks. So there are differences there. We know that some of the, an article shows that you have B cells and T cells, and B cells are what make the antibody that circulate, and you have long-lived immunity. But the fact is we don't really understand about how long the immunity lasts. We hope it's 2 to 3 months where you should be protected. But we also know that people have gotten reinfection in 60 days and 120 days. Some of those didn't have any symptoms or felt better the second infection, but a couple of those people felt worse. So it's very difficult to really understand. We don't have all the data yet because it's so new, because it's so difficult to really identify reinfection. So I would still advise that really taking all of those precautions to try and prevent further spread of the disease. The other issue is even if you do get reinfected and say you aren't sick, you still have a possibility of spreading the disease to others again as well. So I think with taking all of that knowledge together, it's very important to continue to do the things that we've talked about, and that is masking, distancing, hand hygiene, not meeting in large groups. And it's unfortunate right now because it is the holidays and we want to be together. But I think, and I project that things will be vastly different a year from now. And if we can just hold on and do the right things, hopefully in 9 months, even less than a year, things will be a lot better than they are now.
Oh, let's hope so. I think we're all looking forward to that point. Well, one final question before we let you go. Another viewer writes, quote, "My wife and I tested positive in July. We just retested and were negative. We continue to wear masks, social distance, and use sanitizers, but do we have any immunity?" So this is pretty similar to what you were just discussing. I'm assuming you're going to say the answer is it's hard to say, right?
Yeah, it's hard to say. So we do understand that certain populations of people have antibodies that last a long time, and they're very high antibody levels. But you have to remember what creates the antibodies, and that's our B cells. So even though the antibody levels wane, you still should have circulating B cells that if you see the infection again, they are able to ramp up quicker than the first time and create those antibodies. There's another set of cells called T cells that help kill off virus-infected cells in our body. You should have memory with those as well. But we don't fully exactly understand how long that immunity lasts. We know that with normal cough and cold coronaviruses, you can get reinfected 6 months, 9 months, a year later with the same exact viruses. So it's very important to understand that we don't have all the answers yet. But hopefully as we get vaccination, that immunity will last at least for a year to protect yourself. So I think moving forward, we will have answer to those questions, but we don't exactly know. Certainly in the hospital, we don't typically retest patients if they come back into the hospital if they've been positive, say, within the past 90 days. But I think for the general public, the other thing to know that if you've had the disease and you haven't had a very bad course and it was very mild and you didn't have to go to the hospital, we also know that you probably have less antibodies or less high concentrations of antibodies, say, than somebody who had critical illness. So that's the other thing to consider as well. The level of immunity could correlate with the amount of disease that you've had or the amount of symptoms that you've had. But overall, the answer is we don't know. We are still trying to find those answers. You should have some immunity and you should be safe. But as we move forward, we'll have probably more distinct answers to all of those questions. And hopefully the vaccination will help rule out some of those other issues as well.
Absolutely. You know, as we get ready to close here, I really liked what you said a question ago. So I want to go back to that because we all could use a little hope this time of year and as this pandemic drags on. So what do you think, Dr. Hawkinson? Are you hopeful we will get this under control nationwide? Give us a timeline of when you think we could really see things start to change and take a turn for the better.
Yeah, you know, I was really skeptical when Pfizer announced their first findings, and then now you have Moderna, the second company, and then you have AstraZeneca, the third company. We know that there are other companies out there that are also looking at this. So we have several companies in coordination with the U.S. government to try and create large supplies of these vaccines, which, out of transparency, have been shown to be very safe so far. And the initial analysis, although a lot of people have not seen a lot of the data, they look to be very efficacious in protecting us. So if we can continue moving forward, and remember, the quickest time a vaccine has come onto market has been about 4 years. So this has actually moved at warp speed and very quickly compared to other viruses and other vaccinations in the past. So I am very optimistic that as we are using this new and old technology and creating these vaccines and also other treatments, that things will be vastly different a year from now. Hopefully we can start to get together again. We can go to bars, we can celebrate the Chiefs and the Royals in sporting, and we can go to concerts. Right now we can't do that, but hopefully in these next 6 to 9 months, there will be more light at the end of the tunnel, and we will be able to mostly celebrate these holidays with our loved ones and our friends, just as we want to do this year, but really can't.
Yeah, we just need to hang in there for now and make sure we're doing our part. Dr. Hawkinson, to you and your colleagues in the medical field, our doctors, our nurses, our support staff, we can't thank you enough. We know you're putting yourselves in harm's way. We know you're tired. We appreciate you. I just wanted to pass that along from all of us here at 41 Action News. And also to our other esteemed guests, we apologize, we were having some issues, but Mr. Ortiz and Dr. Benito, thank you so much for joining us today and providing that invaluable insight. Remember, the Rebound Kansas City is our effort to help the community try to get back to work, make ends meet, and manage the pressures. If you have a question or a story you want to share, you can always contact us via email at rebound@kshb.com. And you will find all of our Rebound content, including jobs board at kshb.com/rebound. Thank you again so much for joining us, and a big thank you to all of our guests today. Stay safe, everyone.